This is all about nursing. Now, tomorrow, the Ford government is expected to make a health care announcement. Just days after the premier confirmed they're looking at ways to further privatize the health care system to ease the burden on hospitals. But many groups are warning that privatization is not the way to go, and they point to agency nurses. They're hired by private companies, and they're sent in to go to hospitals which are short-staffed. But in the end, it ends up costing a lot more money.
They make double what I make. They are paying $85 an hour for nurses to come and work in an emerge or an ICU. I make 47. So what does that tell the nurses that are actually staff members of the hospital?
ER nurse Nancy Halupa spoke to CityNews back in January about agency nurses who make almost double her salary. They don't get benefits, but the agency charges short-staffed hospitals an additional fee for their services. And the cost has risen through COVID.
Currently, agency nurses is costing the system millions of dollars that do not need to be spent. And that's taxpayers' money, your money. I am seeing hospitals in Ontario that their agency nursing is up ×4, ×7. These agencies are billing out $200 an hour per nurse.
Nurses have been leaving the profession at an unprecedented rate. Angry, the government capped their salary increases to 1% under Bill 124 and burnt out by COVID.
We are on fire, and what kills me is that we've been warning people.
The warnings came to a head this summer when there weren't enough staff to keep all ERs open. 20 closed during the long weekend in July, another 6 the following weekend.
We cannot have our government look at the crisis in our public health care system as an opportunity to create private profit.
The Ontario Hospital Association confirmed to CityNews almost 8 months ago that there was, quote, an extraordinary increase in billing rates paid to agency staff and in turn charges to the public, adding the escalating costs are of great concern. But nothing appears to have changed. Doug Ford was asked about the issue on Friday.
Can I dictate to any private company you should be paying this to your employees and paying that? I just can't.
It's not just what the private agencies are charging for nurses, though. The issue is also that hospitals can't keep enough on staff. This ICU doctor has been speaking out about it.
What are the market forces that exist that are drawing nurses to agency work? I don't begrudge them. I would do the exact same thing. Clearly, working in a unionized position for the hospital is not as appealing as working for an agency today. Nurses are the backbone of the healthcare system, and unless you have a sustainable supply of nurses who are happy in their job, the system will not succeed.
Doug Ford said his health minister will have an announcement tomorrow. So far, there are no further details. Now, he has also said that any changes that are made to the system towards privatization, well, those services will still be covered by OHIP.